sometimes you can have something wrong with your health and not know it. You might have a diffuse range of kind of odd things going on for you physically that you've noticed, but they maybe don't seem related or don't seem to add up to anything. 70% of women who have polycystic ovarian syndrome don't know they have it. And it's polycystic ovarian syndrome, or PCOS, that we're going to spend a bit of time talking about now. Dr. Sonia Davison is an endocrinologist from the Jean Hales Foundation. Hello, Sonia.
Hello.
What is polycystic ovarian syndrome, and why is having it, whether you know it or not, a problem?
It's a very common hormonal problem in reproductive age women, but can extend after that time. It's essentially a very strangely named syndrome, but it's a hormonal problem where women tend to not ovulate or produce eggs very rarely, and therefore periods can be irregular or absent or very erratic. It also is associated usually with excess male-type hormones, which we normally make, but they have consequences such as excess facial or body hair growth, acne or oily skin, and in some women, scalp hair loss. And it's
not an attractive collection of things, is it?
And it's a rotten thing because this is usually something that comes about in 20s or teenage years, and women do not want to be hairy, and there is another part of this, they tend to be overweight. But having said that, there's a broad spectrum. Some are very thin and have acne. Some are overweight, have a lot of excess hair growth and never have periods. And fertility is a big part of this as well for those who want to achieve pregnancy.
So what causes it?
We don't know. If I knew that, I'd be a very famous lady, I think.
Idiopathic.
There are genetic links, definitely. Often I'll see the girl sitting with me with her mum, and you can see that mum has it as well. There are racial links as well, so Indigenous women, Asian women as well, African American women. So there are links there, but we just don't know of a particular cause. So
do we know how common it is? I mean, if as I mentioned, lots of women have it or are undiagnosed, what do you know about its prevalence?
Well, just to make things even more difficult, there are 3 sets of criteria to diagnose this condition, and various people around the world look at different criteria. But effectively, there was a study in Australian women of about 750 women. One set of criteria said it was 8%, another said about 18%, and another set of criteria said about 12%. So I think we can say up to 18%, which is a lot of women. And we are getting bigger as a society because we're not moving as much, etc. And women, when they put on weight, can have this syndrome sort of manifest.
Well, recently I think the guidelines in Australia for diagnosing polycystic ovarian syndrome have been updated. Is that right?
It's not more about the diagnosis, it's more about the management. So there are various things that we do in recognising this syndrome, in saying what is normal, and guidance for GPs as to what's good for treatment, for fertility and for other things. So it's more about general guidance. This is not an easily diagnosed syndrome.
Well, I was going to say, is it actually, with that sort of set of possibilities,
it's too
is it easy
hard.
to miss?
Women will know there's something wrong, but they will go to GPs and GPs will still get it wrong. And even the ultrasound finding of polycystic ovaries, up to 1/3 of normal women can have that. So I have women come with the ultrasound, I've got polycystic ovaries. Well, you might do, but you don't have the syndrome. And I've got other women who have the syndrome clearly, but their ovaries are normal. So it's a really poorly...
So how do you get a definitive diagnosis?
By having 2 out of 3 of those criteria, excuse me, that we mentioned before. So it doesn't matter what set of criteria you use, it's 2 out of 3, or some of the criteria you have to have 2 of the sets of the excess hormones, the male-type hormones, the acne or excess hair, and the problems with ovulation are the mainstay of this. The polycystic ovaries on an ultrasound doesn't really matter.
Right. Now, Sonia, as I understand it, something that's sort of underlying in this syndrome, I think, is insulin resistance.
We think this underpins the whole syndrome. So that's effectively, really, it's hard to explain, but having too much insulin that doesn't work very effectively and that insulin changes the ovaries from a normal functioning ovary into an ovary that doesn't, and also makes increased male-type hormones, which bring about the symptoms which will bring a lady to sit in my office and have a problem.
Well, let's hear a voice memo now from someone who's had polycystic ovarian syndrome for a few years now.
Hi, my name's Samantha and I was diagnosed with PCOS when I was 21. Signs and symptoms that I had when I was growing up was amenorrhea, so irregular menstrual cycles, a lot of abdominal cramping and a lot of fatigue. I was quite tired all the time and I still get a lot of abdominal cramps. I was diagnosed by my gynecologist where I had to have several ultrasounds done and blood tests to check hormone levels. Managing my PCOS these days is quite difficult. A lot of PCOS sufferers are given insulin-based medication to help manage their weight, but unfortunately this actually makes me quite sick, so I'm left to look at my exercise and my diet to see if I can change things that way and try and lose a bit of weight, which is unfortunately quite difficult.
Well, many thanks, Samantha, for providing that voice memo to us. Dr. Sonia Davison, that link to insulin resistance, what other health impacts does that mean polycystic ovarian syndrome brings?
So usually if they do have weight excess, they are therefore at risk for impaired glucose tolerance or step towards type 2 diabetes. That doesn't mean they're all going to get it, but they definitely are at risk, especially when there is that excess weight. And as Samantha said, do you know what? Lifestyle is an extremely important part of management of polycystic ovary syndrome, and even a 5 to 10% weight, and if that's 100 kilos, because some of these girls are 100 kilos and struggle with weight.
Think of how you want your life to be in old age, should you live so long. So things like getting the care you need and being treated with dignity and kindness. Well, that's a fair way from how aged care is working in this country at the moment. Last night, ABC TV broadcast part 1 of a huge crowdsourced investigation where 4,000 people responded to Four Corners' invitation to share their experiences of aged care. Many of the people who responded work in the industry. Here in Life Matters, let's continue to talk about all this together. Now, someone with personal experiences of the difficulties and distress of trying to get good and appropriate aged care is Linda Saltarelli. Linda's the founder of a group called Aged Care Crisis. Linda, hello, welcome to Life Matters.
Thank you.
Now, what prompted you to start this group, Aged Care Crisis?
Well, around 15 years ago, my father suffered a stroke and was hospitalised as a result, and we were told that Dad should be moved to a nursing home, and it was then I realised how vulnerable he was, and we just found it impossible to find a nursing home that could cater to his high care needs. And it was then that's when I got involved with, I set up Aged Care Crisis. And look...
was it a crisis for your family?
We felt it was at the time, and that's why I named the group Aged Care Crisis, and I think we saw how that played out last night. And look, I would like to acknowledge and thank the countless whistleblowers, both aged care staff and family members, as well as all of the hard work that independent volunteer community-based groups
like yours,
like us, and there's several others, that have worked so hard to shine a much-needed light on what is happening in aged care.
Linda, what are the main complaints that people come to you with saying?
The bulk of the complaints that we receive are generally around staffing issues. Australia has woefully inadequate numbers of trained staff by international standards, and because we've been doing this for so long, we have looked overseas, and for example in the USA, each resident gets double the amount of care from trained nurses and 1 hour and a third more nursing care each day. It's just it's just impossible to provide good care with that level of care. I mean, currently the benchmarks our nursing home uses in determining staffing requirements are based on commercial considerations and not research. I mean, these are developed by financial companies that support the providers and lobbies government on their behalf. They are set at levels that make this very poor staffing look legitimate. I mean, one of the most significant factors in providing quality residential aged care is to ensure that there are sufficiently skilled staff on hand to provide that care. I mean, staff frequently tell us they're unable to care for residents properly, given the conditions and time constraints.
Yes, well, we saw that in Four Corners last night. I mean, one thing that I guess really struck me, Linda, was one of the personal care assistants, I think, talked about having an average of 6 minutes with each resident each morning to get them up, get them toileted, get them showered, get them dressed and ready for breakfast. Now, I can't even do that myself in 6 minutes, let alone get a frail elderly person ready for the day in that time.
Yes, well, in our view, and when I watched that part of the program, the problems revealed are more symptomatic of a wider structural problem in aged care that really must be addressed. I mean, decisions are being made not only without data about care, but by people who have no knowledge of the significance of this. Owners and senior management seem to be largely drawn from the business, finance and managerial sectors who have no clinical care experience. I mean, the concerns are that bodies that report on staffing benchmarks to government, industry are using this, and that is the level of clinical knowledge and engagement on which they are based. Politicians are advised by them. They're accepted as authorities or subject matter experts. They are selected from industry and appointed by government and not by those in the sector who actually provide the care. Without experience or data and are willing to contrary messages coming up from the coalface, managers and politicians are effectively shielded from the consequences of their actions. We should not really be surprised at what's happened.
Well, if you have experiences of this kind with aged care, do get in touch. Do please email us, lifematters@abc.net.au. Michael Mackenzie is here with me, Amanda Smith, along with Linda Saltarelli. Michael.
Thanks for that, Amanda. And look, if you're calling through at the moment, we really want to get to your calls as quickly as possible. So as much as we do want to hear your stories, and every story has merit, we do ask you, if you can, to try and keep the story fairly to the point, because we have so many people coming through at the moment on our phones here at Life Matters. Felicity, I might go to you in Sydney. Now, Felicity, your mother had a reasonably good experience in a retirement village. Tell us about that.
Well, it was very difficult for me to let go of my mum, but she had dementia, and she wasn't safe at home. And very shortly after she was admitted to a very large Anglican retirement village here in Sydney, she lost her language, so she could no longer communicate directly with me. However, I work, so I would visit her outside visiting hours, and I saw the nursing home when people didn't expect to see visitors there.
Right.
And it was very enlightening for me, because what I noticed at her particular village was that the staff mum was there for 8 years, which is way, way above average. They had the same staff. A core nucleus of staff was there that whole time.
Which goes to the core that perhaps this is a quality workplace.
It is, yes.
So, Felicity, you said your mother was in high care for 8 years?
She was there for 8 years.
Yeah,
yes.
My mother was similarly with care for 10 years. They're the long stays. It's unusual, isn't it?
Very unusual.
But you get to see a lot.
You do. And I noticed it was also a facility that did not have a policy of medicating patients. So there were 2 occasions when I actually wrote a letter because I noticed people were very distressed and I felt that they needed some medication. And you know what? They were responded to straight away. They weren't my family members, but they were so responsive, really.
Wow.
Very responsive.
Well, hats off to that particular retirement village there.
Yeah, it's good to hear a good story.
Brilliant place. So let me tell you, the matron, she got very ill. She passed away from melanoma. When she was diagnosed, she said she would like to be nursed there. And so the matron stayed there herself.
That's a good sign, isn't it? Thank you, Felicity.